Hey folks, another end of the day here at the office, and I had an interesting case. I guess I figure I'll just share it with you quickly here. This patient on tooth number 15 was referred for root canal therapy, and we kind of scheduled the whole thing for treatment based on the referring dentist's diagnosis. The tooth was necrotic, and of course I did the pulp testing, and the tooth was necrotic compared to tooth number 14. So certainly there was a lesion too radiographically that you could see. On a different angled radiograph, however, you could see that there is some kind of what appeared to be maybe a potentially remainder root of the wisdom tooth when it was removed or not. And so I decided, because of the fact that there was deeper probing in the area, which I had originally thought might be just a sulcular sinus tract or something to that effect, I decided to take a CBCT of this tooth. And of course, upon taking the CBCT, as you move down in an axial direction and you go down, you all of a sudden see that the distal buccal root on this tooth seems to all of a sudden disappear. The mesiobuccal and the distal and the palatal root is still there, and it does show a large area of radiolucency with potential area of drainage on the distal aspect of the tooth, kind of corresponding with what I see clinically. Of course, this didn't quite make sense, and an additional radiograph kind of shows us that what ends up happening, this is actually a fractured distal buccal root, and it has a horizontal fracture and it's floating in the area. So this is not a supernumerary type of a tooth or a portion of the wisdom tooth, but rather the distal buccal root that for some reason, which the patient herself had no idea about, had fractured off.
Now, my personal theory is the cause of this fracture is, if you look on the right side of the patient, she has a wisdom tooth that is impacted. Now, she told me that the wisdom tooth on the left side had been removed a few years ago. And my personal theory is that probably during the removal, some type of a cryo instrument or an elevator instrument was used to remove the tooth following its exposure, and they may have put undue pressure on the distal buccal root of the second molar during this action of removing of the wisdom tooth. The distal buccal root fractured during the extraction of the wisdom tooth several years ago. That could be one possible explanation.
So at this point, the question was, is it really worth saving this tooth or not? Or should I, instead of trying to save the tooth, remove the tooth? Considering the amount of infection that the patient had, of course, also considering the patient's own economic concerns with the tooth, and the fact that the tooth was all the way in the back, and more importantly, the opposing tooth was also in contact with the first molar and the mesial aspect, so that it wasn't necessarily going to super erupt into that space, I recommended extraction for the tooth as a reasonable option. Of course, my job is always to try to save the tooth, but oftentimes we can get blindsided based on this idea of saving every tooth, but rather think as a whole of the patient as a whole in terms of the strategic value of a tooth and to what extent the tooth is going to be helpful and the patient's own motivation. So in this particular case, given the fact that there was resorption going on the distal buccal root where the tooth had cupped out, where the distal buccal had been fractured off, there was deep probing, the distal buccal was floating, and there was only going to be these mesiobuccal and the palatal root that was going to maintain this tooth. I recommended extraction for the tooth. I would be curious to hear your feedback. I'd love to hear whether you would have tried to still save the tooth despite the fact that the distal buccal was fractured, considering in specific situations the tooth could have potentially survived the treatment and the occlusal function. But once again, in this particular case, what tipped the point was the patient's lack of real motivation for trying to save the tooth, considering the fact that there was a little bit of risk involved with trying to save it in terms of, was this going to work for sure or not? And my main concern was really the periodontal breakdown on the distal aspect of the tooth and whether it was going to hold up once the distal buccal had been removed, as well as the mesiobuccal and the palatal had been treated. And I think what I'm going to do moving forward is share with you some of these interesting cases in this kind of an informal fashion without a lot of fancy bells and whistles, but rather just talk about the case and some of the treatment planning decisions that I made. CBCT in this case was certainly helpful. Had I not had the CBCT, I probably would have done the endo on this patient and then Given the fact that the distal buccal root was a free-floating object with necrotic material in there, most likely the distal probing would not have resolved on its own, so we probably have required some additional investigation and possibly at that point either extraction or another surgery to retrieve and remove the distal buccal root and then see if it would still maintain or kind of the area would recover or not. Anyway, I hope this was helpful to you. I'll see you in the next video.